So good afternoon, good morning, good evening, everyone, and welcome to the World Health Organization's partner webinar series. This series is organized by the Emergency Prepared and Response Cluster at WHO. This is a quarterly webinar which brings together thought leaders, advocates, opinion shapers, policymakers, and technical experts to highlight crucial issues on health emergencies in Africa. We're really focused on regional insights and homegrown solutions. The previous webinar focused on the need to integrate climate change into emergency preparedness plans, while also exploring gender-sensitive, locally led, and collaborative solutions. In today's conversation, we will reflect on the Pandemic Accord and its implications for the quote-unquote Global South. Negotiations to produce a pandemic agreement still face a number of challenges, as we have, just about a few more months to go. And we'll discuss this in the two panels. We will also share valuable insights on how to shape a more resilient and equitable response to future health crises. My name is Dr. Ngozi Irandu. I am the co-chair for the O'Neill Lancet Commission on Racism, Structural Discrimination, and Global Health, and I will be your moderator today. Very good to see all of you. Thank you for joining. Now, we invite you to engage more with this webinar series, and if you're interested in presenting at the next webinar, please contact us at the email address provided in the chat. Now, before we begin, I just want to go over a bit of housekeeping. So please note that the translation is available for this webinar in French and Portuguese. Please click on the translation icon on the bottom of the screen below, to select the language of your choice. So you'll see it's like a globe that says interpretation, and that's where you can select the language that you need. And you can also engage with our panelists at the end of each panel discussion by posing questions using the Q&A function. Please note that that's the only place that we'll be able to capture your questions in the Q&A. Please don't use the chat to put your questions there. Use the Q&A function, which is at the bottom of your screen as well. And the chat is what we'll be using, as I said at the beginning, for the IT and logistics issues. Now, to begin today's webinar, we will hear opening remarks from Dr. Moeti. She's the Regional Director at WHO Afro. Dr. Moeti was unable to join us live today, but she recorded a video for your attention, and we'll start the video now.
Distinguished partners, esteemed guests, dear panelists, colleagues, and friends, I extend my warm welcome to all of you to this third edition of the Emergency Preparedness and Response Partners webinar. Today's event is titled Building an Equitable Pandemic Accord, Post-UN General Assembly Reflections. It's a timely topic because less than 2 months ago, our heads of state discussed and adopted a political declaration on pandemic prevention, preparedness, and response in New York. The Pandemic Accord will be the first ever of its kind. The landmark instrument aims to strengthen global pandemic prevention and response. The COVID-19 pandemic profoundly impacted our lives and livelihoods, our health systems, societies, and economies. This happened partly because of failed global cooperation in the face of a pandemic and other public health emergencies. Pandemics and health emergencies do not respect borders, and global cooperation is essential to any response. That is why WHO is spearheading the development of this pandemic accord. At its core, the legally binding instrument must guarantee equity. It demonstrates the interconnectedness of our world and the urgent need to uphold the right to health for all. The agreement will enhance global cooperation among countries of the world without compromising the sovereignty of nations. It is rooted in equity, solidarity, and international cooperation. The Pandemic Accord aims to ensure that all countries, regardless of their development status, have access to the tools, resources, expertise, and capacities needed to prevent, prepare for, and adequately respond to pandemics. As negotiations to shape the accord advance, dialogues such as this are imperative to ensuring that this agreement reflects the diverse perspectives and needs of all stakeholders, including our valued partners gathered here today. Your expertise, insights, and commitments to equity and solidarity are essential to a truly inclusive and effective accord. Our unity is paramount as the world faces multiple crises, including conflict and climate change. Pandemic Accord stands as a testament to our collective commitment to addressing not only health emergencies of today, but also the broader challenges that threaten the well-being and sustainability of our global community. WHO is working with the African continent, including through the African Union and its agencies, and with other partners, to ensure that its needs are appropriately taken into account. Together, we can forge a path towards a more resilient, equitable, and interconnected continent and world where the lessons of the COVID-19 pandemic become the guiding principles in preparing for the next, which experts already predict is not far from us. As we look forward to countries adopting the Pandemic Accord at the 2024 World Health Assembly in May next year, let us continue to work together, united by our shared commitment to protecting the health and well-being of all our people. I thank you all in anticipation of your valuable contributions today and for joining us in pursuit of our shared vision for a healthier and more resilient world. Have a very fruitful webinar.
Excellent. We're very grateful to Dr. Moati for making the time for that video. I think there's so much in what she said about unity being paramount in the times that we have at the moment. And so we look forward to hearing how that unity can be achieved in the subsequent panels. Okay, so now it's time for our first panel entitled Equity Matters, Views from Across the Globe on the Pandemic Accord. So we hope to have a candid discussion with our global partners to discuss their views on the Pandemic Accord, because the Accord has the potential to strengthen global health security, but its implementation must crucially respond to the requirements of all nations, and the stakes are high. Will this platform truly allow for us to have courageous conversations to talk about the Accord's merits? I really hope so, because it's very easy to talk about the same kind of concepts and language that we've been using for months now, when there have been some real sticking points. So I really invite the panelists to be open and honest as much as they can in the capacity that they're speaking in. All right, so let me introduce our panelists. I'll just introduce everybody together. We have with us Colin Missif. He is the Deputy Assistant Secretary for the Office of Global Affairs for the U.S. Department of Health and Human Services. Welcome, Colin. We have Stephen Savey, the Deputy Director, Health Strategy and Security Department and Global Health Director at the FCDO in the UK. So welcome, Stephen. And Martin Winstam, the Minister Counselor for Global Health, Labor and Social Affairs for the EU delegation to the United Nations in Geneva. Welcome, Martin. And finally, we have Young Fei, who's the Minister Counselor of the Permanent Mission for the People's Republic of China in Geneva. So welcome, Young Fei, and welcome everybody. You can turn on your cameras if you haven't already. Making sure. Okay, thank you, Stephen. Just make it Martin. Okay. Okay, I think you might be having some video issues. Apologies. I don't see your camera, but maybe others can. I'm not sure, but hopefully you can still speak to us. Okay, right. To kick off this panel, let's set the stage. many look at the global health decision-making process as being less of an actual solution and more of a show by our leaders to demonstrate that something is being done into COVID-19, in response to COVID-19. So I'm curious what our panelists think about this and what their hopes are for their hopes and concerns are for the pandemic accord. If we could start with you, Deputy Assistant Secretary Colin, over to you.
Thank you, Dr. Ngozi, and good morning, good afternoon, colleagues. It's great to be with you all today. It's really a privilege, and I really appreciate the provocative questions as well, and hopefully we can get into a good discussion. From my perspective, more than 2.5 years ago, when these negotiations began following the World Health Assembly in 2021, there was a really open question. A number of member states, including many from the African region, as well as the European Union and the UK and others, called for a pandemic treaty. And I think that there was a very big question at that time about whether or not such a treaty would actually be beneficial, or was it really just a performative act, as Dr. Ngozi was suggesting. I had the privilege to co-chair with my colleague from Indonesia, Ambassador Grata, the sort of preparatory negotiation, the working group on preparedness and response for that first year before the INB and the working group on IHR amendments got going. And I can say personally that question was very definitively answered, at least from my perspective, through that 1 year of preparatory work, that it was crystal clear that there are major gaps in the global health architecture that must be filled, need to be filled for our collective health security and collective health equity. And in fact, the number one reason that came out of that negotiation and those discussions for why we need this pandemic agreement is in fact the question of equity. I would say, from my U.S. perspective, parts of the system worked really well. Innovation worked really well in terms of getting new vaccines ready to go more quickly than anyone would have thought possible. Where there was a complete breakdown, obviously and unfortunately, to all of our collective detriment and pain, was in the distribution, the equitable distribution of that innovation. And so I think with this pandemic accord, we really do have some opportunity to advance in a number of key areas. And I'll just say a couple of them now to start off. I think, some of the areas that we are supporting from the U.S. perspective in terms of how to operationalize equity include expanding local and regional manufacturing. We believe that there is a need for a functional and effective ABS system that covers both more rapid access to samples around the world and more rapid access to medical countermeasures, as I was just saying. We think that it's important to have a strengthened coordination of supply chain and logistics networks. We also think that it's very important to strengthen IHR core capacities and regulatory systems. I think one of the things that really has struck me over the course of these negotiations that I've heard loud and clear from many developing country representatives, and I think this is an absolutely fair assertion, is that it is not acceptable to have a negotiation, whether it's the pandemic agreement or the IHR amendment process, that seeks to create a whole series of new obligations without commensurate capacity building and support to ensure that countries actually can meet those obligations. It is really about a collective responsibility. And I think the last thing I'll say is that, the fact that these, Ngozi, you mentioned the headwinds against this negotiation, and it's very true, unfortunately. I think as the acute phase of the pandemic recedes and it's less in policymakers' minds, especially maybe legislators' minds who write the checks, it's harder and harder to get that political will going. But that said, and the geopolitical situation is very challenging, but it's great to see Feng here as well, because I think one of the things that gives me hope is that countries keep showing up. And we keep continuing to try to work through the problems to see where we can find that consensus. So I really do think that progress is possible in each of these areas in operationalizing equity. It may not be everything in the first bite, but let's definitely keep at it. And I look forward to the discussion today. Thank you so much.
Many thanks, Colin. So over to you, Minister Counselor Martin Witstem, and we can see your video now. So I saw it earlier, so please go ahead. Actually, there might still be some technical issues, so let's go to Stephen Savey with the Foreign Commonwealth and Development Office in the UK. So same question, Stephen. You know, can you assure us that this is more than you know, performative, and you know, what are your hopes and concerns for the pandemic accord from the UK? Thanks.
Yes, thank you very much, and thank you for inviting me. I'm really pleased to be here. I'm very keen to listen, actually, as well as to speak. If you've been following the news, you'll have seen we've had some big ministerial changes here in the UK. So you know, we'll need to work our position through with our new ministers, but I think we certainly feel encouraged. One of the first things that our new Foreign Secretary did was to sign off in his forward for our new international development white paper, which I think when everyone sees it in a couple of weeks' time will set out very clearly the leadership role that we're very strongly committed to continuing to play in development and in global health in particular. But to answer your question, you know, I mean, is this just performative? Absolutely not. And there's a really simple reason for that, because this is in everyone's interests. We know that another pandemic could come soon. We know that the world was not in the right place for COVID. I think, as your own briefing paper said, it's essential that we find common ground. The absence of a treaty leaves the whole world vulnerable to future pandemics. So you know, I hope that's very clear, and I think everyone is negotiating in really good faith. So you know, what are our hopes and concerns? Firstly, you know, we've only got 6 months. That's not long. We want to be really ambitious about the pace of the negotiations. We will bring our full efforts to it. We need a good, clear process to get us to where we need to be. I think secondly, you know, we're clear about our priorities, and again, this is from listening to lots of counterparts. You know, what do we want the accord to do? Ensure faster and more equitable access to affordable vaccines, therapeutics, and diagnostics. Strengthen collaboration on scientific research and development. Enhance coordination across different sectors to prevent zoonotic spillovers. Improve, crucially, data and sample sharing, and of course build stronger health systems which need to underpin all of this. And as part of all of that, we really want to see opportunities created for Africa, particularly in the accord. So yes, I mean, securing more equitable access to countermeasures, clearly really important, and it's a priority, I know, for many in Africa, just as it is for us. And I think we're really keen. We're not there yet, but to work together to find landing zones for consensus on what the best measures are. And actually, what we're driven by is not rhetoric. It's not ideology. It's what will actually work to deliver the outcomes that we need, and that's why we're really keen to be engaging experts through the process, so that we can understand that as well. You'll know that we've been very keen on integrating prevention and One Health, and I want to just say a word about that. But you know, we're doing that because of equity, and I think it would be very unfortunate if there was a sense that there's any kind of trade-off or either or there. we know that 75% of emerging human diseases originate in animal populations. We know that when that happens, it's the poorest and most vulnerable populations that are affected first. So we see a strong One Health and prevention aspect as being really important for equity, not obviously alongside the preparedness and response piece. And I think one other thing it's important to say, you know, we absolutely recognise that countries are starting from a different place in terms of prevention and One Health, and that there will absolutely be a need for capacity building, and we're absolutely very much focused on that as well. Of course, there are areas where we don't agree. Intellectual property is the key one. Again, that comes back to our litmus test, I think, of what will actually work in practice to deliver what we all want, rather than creating actually disincentives. The last point I wanted to flag, I think, is on local manufacturing, where I think, we can see that there really is an opportunity for Africa. So we are keenly supporting that part of the Accord as well. It's a complicated endeavour. There's lots to get right, but a really important part of the Accord as well. Thank you.
Thank you so much, Stephen. Okay, our next panelist to answer the question is Yang Fei, Minister Counselor of the Permanent Mission of People's Republic of China. So over to you, Yang Fei.
Okay, thank you, Dr. Ngozi. I'm not sure if I'm audible.
Yes, you're audible. We can hear you. Thank you.
Okay, thank you so much. And also, I thank WHO African Region Office for inviting me to this very important webinar. And also, it is my great pleasure to be invited and to be here to share with you our views on the pandemic accord or treaty. And with regard to your questions, I think overall, our hope is to reach a fair, implementable, feasible, balanced, and legally binding international accord or treaty, which can solve the outstanding problems or challenges we were facing or experiencing during the prevention and response to the current COVID-19 pandemic, and to better prevent, prepare for, and respond to the future pandemics. And technically, we hope that this treaty, this pandemic accord or treaty, under international health regulation, could have very clear demarcation on prevention, preparedness, response, and recovery stages to synergize each other and avoid duplication, and established a complete international system that highlights the principle of equity to prevent and control future pandemic and other infectious diseases with pandemic potential. I think last but not the least, we do hope member states can build mutual trust, which we believe it is very important through the whole negotiation process. And it also can be fully reflected both in the future accord or treaty and amended international health regulation. So these are our hopes during this negotiation. And our biggest, I think, concern or worry is that the negotiation will not be completed before May next year. And otherwise, we will lose political momentum for negotiation. So we do hope we can conclude the task assigned by World Health Assembly to all of us. So we hope the whole negotiation process can go as scheduled. So that is my hopes and concerns. Thank you.
Thank you so much, Yang Fei. Hearing very similar concerns around timelines. So just picking that up. Let me just see if Martin.
I think I should be fine now. No?
Oh, yes, you're fine. You're perfect. Thank you so much, Martin. Now, over to you to just reflect on the question about hopes and concerns, but also authenticity. So over to you. Thank you.
Yeah, thanks, Dr. Ngozi, and sorry for these technical challenges that appeared all of a sudden. It's kind of typical sometimes, but that's the way it is. And also from my side, thanks a lot for the possibility to participate in this webinar. Thanks to the WHO Afro region for convening us, and a very useful opportunity to exchange in this setting, also with stakeholders on where we are in the negotiations and how we can move forward in the best possible way. Yeah, so looking at your guiding questions, and the first one about the hopes and concerns, of course, similarly to the previous speakers, our hopes would also be that we can indeed use this, what we would refer to as a window of opportunity, to agree on a successful pandemic agreement that will address the full cycle of pandemic prevention, preparedness, and response, and that will make the world at least a little bit of a better place. We think that this window of opportunity is not unlimited in time, however. So this would be one of our concerns, similarly to what was just expressed by my colleague from China. But you know, just staying for a few more seconds on the topic of our hopes. I mean, it also comes with the hope that whatever we'll be able to agree upon will be more than just beautiful words on paper. I think the world has enough of political declarations and aspirational resolutions. So I think what we need now is an agreement that will entail concrete obligations that we can, with some degree of honesty, convey to the outside world will change the world to the better once it enters into force and becomes operational. So this would be our hope, that's where we'll take this process. As to our concerns, of course, in addition to the time factor, because we sense that, you know, it is indeed a window of opportunity where the world is willing to devote enough attention to the topic of pandemic PPR to enable successful negotiations of international agreements with new obligations. So we should recognize this, and we should definitely try to make the most out of this window of opportunity. The concerns, in addition to that time aspect that we would have, would also be related to, you know, looking at where we are now in the negotiations and how we can move towards a successful outcome already by May next year, which is arguably within a short period of time, that we would hope that we can avoid a sort of zero-sum approach to the negotiations, whereby you would perceive that the gains of some would be the loss of others. We would very much favor an approach whereby we look at the common interests that we all have and identify shared objectives for this endeavor. We think there are very, very good arguments as to why this process would not have to be a zero-sum game. There may be other areas of international relations and negotiations where it's difficult to avoid that. Whereas here we think that we have embarked on a common journey that arguably should guide us towards common and very much shared objectives. And I think to the extent that we can enable this to influence the dynamics and the atmosphere in the negotiations, I think we'll have a greater likelihood to reach a successful outcome. So by way of concerns, we're slightly concerned that we don't want to end up in a scenario where the idea of a zero-sum game is gaining too much traction. Looking then at some of the specific questions that you've put specifically to the EU, there was this question about whether the current draft accord meets the expectations in terms of doing the trick, if you so wish, of improving the world when it comes to pandemic PPR. I mean, our short answer would be no, not yet, but we hope eventually it will be. We think that currently, and this is building on perhaps from what I just said in the general remarks just made, that the current draft suffers from an overall perspective from a certain lack of clarity and specificity when it comes to what are states parties expected to do when they implement this agreement to ensure that they are in compliance with it. And it comes back to what I was saying about we want more than just words, aspirational words on paper. You know, what we're working towards and what we hope that we can achieve by way of an agreement is concrete provisions that will make it as clear as possible what state parties are expected to do and what actions they are expected to take as a result of this agreement, and that those actions arguably and objectively will make the world a better place. And we think we're not quite there yet. Yep.
No, thanks so much for that. I think you've already started with the second round of questions, and that's great because I'll move on to the next colleague, and then I'll come back to you for the last question, if that's okay.
That's totally fine. Yes, thank you.
Mm-hmm. Great. Like I said, I'm hearing very similar concerns when it comes to just having a little bit over 6 months left to negotiate, but also quite a bit of hope and some agreement that everyone's coming to the table with good faith, and that the governments represented here believe that there can be movement, even though there's a very short time to get I guess consensus really is what we're striving for. But let me go on to asking some individual questions to the panelists. Colin, if it's okay, I would like to ask you about the U.S., which is a major stakeholder in setting up, the previous global health architecture, really, which has been criticized for, disenfranchising poor countries and not being equitable. So could you tell us a little bit more about how the U.S. will work with partners to ensure that the pandemic accord is implemented in a way that's equitable and inclusive? I mean, you've already talked a little bit about process, but it'd be great if you could give us a bit more detail to your approach. Thank you.
Sure. Thanks. Thanks very much for that. I would say that I think one of the things that we are supportive of is, and we hear very loud and clear from colleagues, for example, from the Africa group in the negotiations in Geneva, is the important role that WHO plays at the center of solutions. Not that WHO necessarily has to do everything, but that as the universal membership body that is a democratic institution that every country is a part of, that is a key part of, in contrast to exactly in fair contrast, frankly, to like the different funds and programs that are certainly doing a lot of important work on equity and basically improving health and well-being on the ground, but are not necessarily governed in that same inclusive way. I think another aspect of this that we are interested in exploring more and are trying to develop really more concrete ideas for in these negotiations are empowering, in a sense, regional solutions, so that everything doesn't have to be taken at the global level. People who are outside of health often, think about the regional office and the regional structure of WHO as a weakness, because I think they frankly don't understand that, and there certainly are challenges. But the fact that the regional offices are closer to the ministries of health and closer to the ground in terms of the actual problems and the actual solutions is something that we also want to lean into, and we think that will be helpful for all of the regions of WHO, frankly. So I think those are some of the elements. I think the other thing that I would stress here from a public health perspective that Martin referenced as well is that these do not need to be this doesn't need to be a zero-sum game. And I think in the chat, noticing some of the questions, there was a lot of discussion about empowering developing country voices in decisions around things like regional stockpile establishment and selection and understanding how that goes. These are absolutely things that we strongly support in terms of how we can empower those who are actually living with those circumstances and dealing with that. It shouldn't be decisions in Geneva or Washington or Brussels, frankly. It should be decisions that are taken on the ground where the situation is known. Thanks.
Thanks so much for that insight. I think we definitely agree with that regionalization and empowerment. And thanks for noticing the questions in the chat. I'll ask a couple more questions to the panelists, and then we'll get to that. But if the panelists do see questions that they want to incorporate in their response, please go ahead and do so. Okay. So the next question is for Stephen. Just, the IHR was legally binding, right? And we know that during the biggest emergency of our lives, most countries did not comply with them. And so why should African countries have confidence that rich countries like the UK will be loyal to their commitments in this pandemic accord?
Thank you. Yeah, it's a fair challenge, but I think the answer, it comes back to what I said at the beginning of my first answer, that this is in everyone's interests. That it's in everyone's interests to have an international rules-based system which works, which we're all invested in, which we all have ownership of, and that's why we're so committed to getting an accord. As my Chinese and other colleagues have said, by May, because we don't see that there is any value or anything to be gained. In fact, the reverse from continuing beyond that. And I hope I hope the UK's record over many years of investing in global health speaks to our commitment to this agenda. We remain, for example, the biggest contributor globally to Gavi's core mission, and a number of other areas that we're working on. I think there's also a link here to your question links to the importance of accountability being built in well into the accord, which is an important focus. And certainly, I think the world will hold us to account. Our own civil society will hold us very strongly to account. Will hold our government very strongly to account for implementation of this accord as well. Thank you.
Excellent. Thank you so much. Yangfeng, I just wanted to ask you about really about how African governments and low-income countries can meet their commitments. I think someone actually mentioned it in the Q&A, but there's, when you look at Ngozi Okonjo-Iweala and the WTO, a lot of the guidance coming from there is that really, in order for, before we start talking about a lot of tech transfer and some of these advanced discussions about building the competencies, we have to really talk about the investments in the government, and with the debt challenges after COVID that kind of compounded on existing debt. it's going to be very difficult for countries to meet these commitments. Can you talk a bit about like what China is doing to support countries and being able to have the financial capacity, capability to meet the commitments that are outlined in the new pandemic accord?
Okay, thank you, Dr. Ngozi. I think for China, I happened, to be responsible for health cooperation between China and African countries before I take this post in Geneva. And I think like China has also a big, how can I say, development programs in the developing countries, especially in African countries. But our main focus is a little bit different with other countries. We focus our support in infrastructure building. And we think that is our, relatively our advantage compared with other countries. And from our own experience, if you have no health infrastructures, there's no way for the developing countries to improve their health system. And not only the buildings, but also the labs, the equipment. And we believe all of this are a part of the infrastructure building, and also belongs to capacity building as well. I think also, I think we are not the traditional donor compared with the US or UK. Just now, I think our UK college said UK is the largest donor to Gavi. But we are not the traditional, donor in this area. Our support is mainly through the bilateral channel, and I think like this is kind of a history reason, and people may believe maybe support through the bilateral channel may be more efficient and more fast compared with the multilateral channel. So but I think China is how can I say is I'm not sure is for better or for worse, but we are working towards to be a multilateral partner in the international development area. For example, we launched global our own global development agenda last year, and also during the China-Africa Summit, FOCAC, our leaders also commit our support to the African countries. I think health is one of the priorities in terms of our future cooperation with African countries. And so from my own perspective, I think in the future, probably we will combine multilateral with bilateral. And also, I believe for the pandemic treaty, when we're talking about the pandemic treaty, I think China can work with the developing countries together to strengthen our capacity. Because one of the inequitable problem is the capacity between the developing countries and the developed countries. I think China is ready to work with the developing countries under the treaty. What do you call it? Or treaty to take advantage of the relevant articles inside the treaty. For example, health workforce. Article 7 about health workforce, and also Article 9 scientific research, and also I think Article 8 is about regulatory cooperation. So there's many articles. I think the developing countries can work together and to strengthen our capacity and to improve our access to the medical countermeasures when we prepare for the next pandemic. Over.
Thank you so much, Young Feng, for that comprehensive answer. So Martin, back to you. I wanted to, just kind of build on what you were saying when you were talking about the concern around timelines, and your acknowledgement. This is, and everyone's acknowledgement, this is a very ambitious timeline and an ambitious agreement that we're trying to, get to. And you spoke about, very clearly spoke about how that you want to avoid this zero-sum game position. But we know consensus building takes a lot of time, and often deadline diplomacy doesn't lead to substantive or successful outcomes. So could you tell us what the EU is doing or willing to do to overcome the perceived lack of legal obligations for fair access to countermeasures? And what specifically do you think can be implemented to rebuild trust with the EU and the global North, with the global South, for future health crises?
Yeah, thanks for those questions. I think to begin with, I think that the shortcomings that became apparent during COVID-19, those shortcomings are best addressed by way of a multilateral rule-based system that will put us all in a better place to both prevent pandemics to happen in the first place, but if they do, to be better equipped at dealing with them, including on the very important response side. So I think the way to rebuild trust is part of why we're doing this exercise in the first place. We identified a number of shortcomings in how the world community dealt with COVID-19 pandemic. And our conclusion was that those shortcomings arguably should lead to a round of negotiations to see if we can create a rule-based systems for how we deal with PPR at a global level. And this is still our firm commitment that this is the way forward, and this is what we're working intensively to try to achieve. And perhaps, I guess I would argue that the degree to which we saw unilateral actions and measures being taken by various countries around the world as a result of the COVID-19 pandemic partly was due to that lack of a multilateral rule-based system and a lack of trust and confidence that we can address this together as the world community, and therefore you instead choose a unilateral pathway that may benefit yourselves, but it's not going to work in the interest of everybody. And I think that's essentially what we have to address as part of these negotiations, and work towards, as I put it in the first introductory remarks, works towards common shared objectives in the interest of all of us. Now, this is of course easier said than done. And I think you alluded to one in particular very important area that I think, without a successful arrangement on that particular topic, there will simply be no pandemic agreement, and that is how to ensure equitable access to countermeasures to all those who are in need of those in the case of a new pandemic. And I think that there's been a lot of discussions, of course, around this topic. Our firm belief is that this is still a key essential part of the pandemic agreement that we need to address in a credible way that will enable us to convey to the outside world that, with this agreement, we're definitely in a better position than we were before this agreement. Now, that we've spent a fair amount of time internally within the EU on trying to identify, what would our suggestion for how to tackle this important topic be. And then during last year, we presented our, approach as to how this could be done by way of concrete obligations upon the high-income countries and those who are in a position to do so, to undertake certain actions as part of any procurement contracts with manufacturers of countermeasures. Now, what we put out there on the table didn't necessarily meet the liking of everybody. That was clear. I guess that's part of international negotiations. You introduce an idea, you see what reactions you're getting, you try to work around the concerns that are raised and move things forward. And I think we're still committed to doing this. I think that we've learned a lot by listening to the views of other partners, and we continue to work intensively in trying to come up with new ideas for how we can ensure this. But essentially, and coming back again to what I said about in the beginning, that we do not want to work towards declaration type of agreement with aspirational provisions. We want as clear as possible provisions that are as clear as possible, and that will deliver obligations upon each and every state party to the agreement to undertake certain actions. And we think part of those obligations should be aimed at ensuring equitable access to countermeasures. I think that's very, very clear. And this will remain one of the key topics for further discussions in the weeks and months ahead. That said, I would very much agree with those who already pointed to the fact that, and I mentioned it before as well, we need to cover the entire PPR cycle if we are to be able to call this agreement a success. If it's an agreement that will not make the world community better equipped at preventing the future pandemics from happening, then essentially this is a bit of a lost opportunity. I think it's not any decade that we get the chance to develop and adopt international rules, new international law, if you so wish, on pandemic PPR. And again, we need to use this window of opportunity as best we can, and that means concrete provisions across the full PPR cycle, so that we all can feel that we're in a position where we can also say to our citizens and people in our respective countries that yes, the world is better equipped, we are better equipped also at national level to prevent pandemics from happening in the first place. Should they still happen, we're better equipped at handling them in an equitable manner.
Thank you, Martin. I'm going to go into the Q&A. I think that some of the elements that the Q&A are bringing up, I think you all have answered in your comments, but I'll read three questions and then I'll just open it to the panelists. But I'll just ask the panelists to keep your responses to 2 minutes so that we can move to the next panel on time. The first question is about transparency. So it's a little bit deeper into what I was saying earlier. And transparency emerged as a key lesson from the COVID-19 pandemic. So how can the pandemic accord be fortified to ensure transparency serves as a robust mechanism for accountability and equity? So that's the first question. And I actually don't have a name to that one, so apologies. The next question is from Isatou Sarr. Are there provisions for meaningful sharing of pathogens, data, and tools? And finding combined obligatory sharing of pathogens data and benefits sharing on equal footing between the global north and the global south. That's the second question from Isatou. And the third question is from Nihashon Aluoka. Intellectual property and tech transfer remain a sticky issue amongst the equity articles. This has implications for local and regional manufacturing that many developed countries are supporting in Africa. What is your perspective on IP and tech transfer during emergencies and pandemics? So I think I would appreciate if just each panelist could maybe take one. So whoever wants to take this one, if you could go ahead and then, okay, go ahead, Colin. Thank you.
Sure. Thanks very much. Thanks very much, and thanks really for the many great questions in the chat. I wish we had more time, and hopefully we can do this again. I would say that this is an area where there is some potential. While there is disagreement in the room in terms of the national delegations from Africa Group and other parts of the developing world and in the US and others on the tech transfer, I will say, though, that this is one area where I really hope and expect that we can come to a good outcome, because we strongly support a strong tech transfer regime in this accord, but we do believe that that especially when we're talking about things like vaccines, it really does need to be on voluntary and mutually agreed terms, because we're not only talking about the IP itself, but we're also talking, of course, about the know-how on how to produce those vaccines and do so reliably, effectively, etc. And I think that there are ways that we can, my health secretary, Becerra, talks about this accord, this agreement as a really important collective bargaining opportunity that member states have vis-a-vis the private sector. And so even if these terms remain voluntary and mutually agreed terms, we're establishing new norms of behavior. So for example, so the transparency point is a really critical one, which we support, transparency of contracts, and we're pushing industry hard on that, so that there aren't basically it's no longer can be business as usual, where companies just put the screws to small countries, or big countries for that matter. I know I need to wrap up, so but this is an area that I really believe that we can create big changes in the system, even if those are in a sense voluntary changes and not hard law. They can create new norms that will make a big difference in terms of future pandemic preparedness and response. Thank you so much.
Thanks, Colin. I appreciate your answer. I think, the hesitancy and the fears that volunteer is kind of what we had before, not exactly, but and it didn't necessarily lead to the right action. So Yangfeng, over to you. Thank you.
Okay, thank you very much, Dr. Ngozi. I would like to take the question of the transparency and accountability. China fully supports the transparency of the sharing pandemic information and other relevant policies, and need to be as transparent as possible. And at the same time, we also believe that transparency issue or transparency principle should also be reflected in equitable terms, such as transparency in benefit sharing, transparency in pathogen sharing, transparency in technology transfer, and the transparency in regulatory policies as well. And also the allocation mechanism, which I think we need to talk this in the negotiation. This mechanism, allocation mechanism, also absolutely need transparency. And so is a so-called tiered pricing process also need to be as transparent as possible. And when we talk about the accountability, and I think that is a very relevant issue. And China also focused on the feasibility and implementation, implementability. Sorry, my English, it's difficult to pronounce this very long word. China advocates that common but differentiated responsibility should be reflected in the pandemic accord or treaty. We agree that all countries have common responsibilities in detecting, preventing, and controlling diseases. However, due to the different capacities of the different countries, there are certain differences which should be addressed also when we're talking about responsibility or accountability. And we must consider the situation in the real world. And due to economic development level and other very complicated reasons, developing countries have insufficient capacity in disease monitoring and surveillance, also in disease reporting, pathogen identification and detecting, So all the responsibilities of the accountabilities of the developing countries cannot be equal to those of the developed countries. The developing countries cannot be required to bear the same responsibilities which are beyond their capacity. And so we really need to be realistic in this situation when we negotiate on the new accord or treaty, and also during the international health regulation amendment process. Over. Thank you.
Thank you for that answer. I mean, this is a very important point that a lot of African countries and other low and middle income countries have been arguing about a common but differentiated responsibility. And so it's important to hear this point. And I know colleagues, I think very clearly our EU colleague Martin, you were saying that you talked a lot about shared responsibility. And so I think when we're talking about consensus and really how we get to it, this sticking point is something that we probably need to dig deeper in, and we'll continue to dig deeper in through the negotiations. So Stephen, I'm just going to give you the last word on the final question. So over to you, but please 2 minutes, and I'll try not to opine too much, but 2 minutes. Over to you.
Sorry, I think I'm unmuted now. Sure, thank you. Well, I mean, let me say on behalf of all the panelists, a huge thank you both to you, WHO, for organising, for all the excellent questions that have come in on the chat. I mean, the three areas you've highlighted, all clearly important areas. Not the only important areas, I think, as I was saying before, and you know, we really are strongly ambitious. So, you know, for example, you know, if we really want to build up regional and local manufacturing, you know, yes, we need to look at technology transfer on voluntary and mutually agreed terms. But we need the Accord to do more than that. You know, we need to look at infrastructure. We need to look at workforce. We need to look at regulatory frameworks. And as I said at the start, you know, what's most important for us is looking at all these things and focusing on what's not going to sound beautiful, but is going to work and achieve the desired effect in practice. So we are listening hard to others at the moment on each of those three areas. We want to make sure that we are complementing other international agreements, for example, the Nagoya Protocol under CBD, on things like transparency. Clearly, that's also very important. We need to make sure that we don't do anything on transparency that accidentally creates a disincentive for lower prices for developing countries. We need to make sure we don't do anything on pathogen sharing, which is hugely important, that actually disincentivizes it in practice. So that, I think, is the key for us. If I may, in my very last remark, I just wanted to pick up maybe the question that hasn't come up, but I think is important on finance, which is clearly going to be an important part of the Accord. We are very conscious of that. We are certainly working with others on the whole range of financing issues around surge financing, for example. But one point I just wanted to highlight was that the current draft of the Accord proposes establishing a new fund for capacity building. And I guess it's just a bit of a challenge back to the group to think about. So we fervently believe that there is a strong need for support for capacity building. I think that is not in contention at all, and we will play our part to bring that about. But what we hear from so many of our African partners working on the ground is the frustration that there are already so many vertical funds, mechanisms, and that your health ministries just find it so unnecessarily difficult to report separately to each of those separate funds and initiatives and service them. So we feel very nervous about the idea that the solution to this problem is the creation of yet another fund. And I think we want to look really hard at, can we make the mechanisms that we have already work better to achieve the same objective? Thank you.
Thank you so much, Stephen. I think that's a good question to pose to our second panel, which I'm going to introduce shortly. Martin, I'm really sorry, but we're going to have to move on to the second panel because I've already run over. But hopefully, if the questions can be sent to you, or our WHO colleagues can facilitate anything else for you. I just want to thank this panel, and I'm going to move on to the next panel. Okay, so today, well, just to say, not just thank the panel, there was a really enlightening discussion. I think that there's a lot that we can reflect on as we move forward, and hopefully that can actually be incorporated within the negotiations. Okay, so for the second panel, we have with us Dr. Ebere Okereke, who is the CEO of the Africa Public Health Foundation, and she's also an associate fellow at the Chatham House. We have Dr. Sultani Hadley Matindichero, the vice chair of the working group on the international health regulations. And we have Noah Elias Tegene, the policy, health, diplomacy, and communication specialist at the Africa Centers for Disease Control and Prevention. Welcome to you all, and thank you for joining. I'm just going to, okay, so Dr. Okereke, I see your video. Okay, Tegene, I see that, okay. Dr. Sultani, thank you. Yes, all of you are here, thank you very much. Okay, so similar to, actually, I think we're actually, in order to incorporate all the great questions that are coming here, I'm going to ask you each a question, but then for the second round, I will pull the questions directly from the Q&A. I hope that's okay, not too destabilizing. But instead of a general question, I'm just going to start with an individual question. So, Dr. Okereke, during COVID-19, Africa relied heavily on the quote-unquote goodwill of developed countries to obtain pandemic-related resources. And then we know that this led to late delivery of drugs and vaccines, and that contributed to COVID-related deaths. So can you tell us how countries in Africa are pushing for equity in the pandemic accord, and how can some of the statutes that they're pushing for, how can they remedy this challenge?
So first of all, thank you, Ngozi, and thanks to the WHO, the organizers, for inviting me to join this very interesting conversation. And I was really enjoyed the reflections and the discussion from the first set of panelists. So I'd like to start by making a slight correction to the assumptions in that question, because there is a perception that Africa just waited and stood there waiting for something to, for the goodwill of the global north to provide us with the solutions that we needed to respond to the pandemic. And that's not the whole story, is it? The Africa Centers for Disease Control very rapidly generated consensus on the continent to start to build resources to enable them to access the solutions. The problem was, quite frankly, that even though there were funds, maybe not enough, but Africa Union did actually, with the Afrexim Bank in particular and other funders, generate a significant amount of resources. They looked at pool procurement mechanisms, but they couldn't actually access those countermeasures because the richer countries who were first in line bought up not just what they needed, not everything that was available, well beyond what they required. So I think it's important that we, in starting off the premise of this question, that we actually identify that the primary issue wasn't just a question of waiting to receive, but that there were mechanisms that, or there were actions taken by the more economically flexible countries that cut African response out of the conversation. And that is one of the main reasons why the African countries' contribution to the discussions around the pandemic accord have been very insistent that equity and fairness and equitable share to the resources isn't just a token conversation. It needs to be built into the systems and independently monitored so that we can actually hold ourselves to account. Because personally, I have no confidence that should the next pandemic start again tomorrow, that we won't see a repetition of this same issue about some countries procuring more than they need, and putting their own national interest well above the global interest. And the consequence of the way that we responded the first time was that we all suffered. It wasn't just that deaths and were higher for those countries who were delayed in having. The response, the whole pandemic epidemiology, and I would say, was affected by the way we distributed access to these essential products during the pandemic. So, and I want to just step back and just make an observational comment on the structure of this conversation. We almost seem to be perpetuating that us and them, in that we had panel one, which was the more affluent global north, and then panel two, the African perspective. And I know that this is a WHO Africa region dialogue, but we need to stop seeing ourselves as two worlds. So long as we continue to see ourselves as two worlds, we will not reach a conclusion that benefits all of us equitably. And so the dialogue has got to change from the low income versus the high income, the global south versus the global north, to say, if we really genuinely are committed to protecting the world from the catastrophe that we've just seen, and this is, COVID might have been the most acute one, but we shouldn't forget that there's still an HIV pandemic going on. We have got to stop thinking ourselves in this dichotomous way. And to reflect one of the earlier panelists said, looking at the cake as if it's an infinitesimal, it's a fixed size, that in order to give more to one country, another country has to go. So we need to actually expand that cake. And so part of how we do that is diversifying manufacturing. We've got to actually look at making sure that we don't continue with the current situation where almost all the manufacturing is in a very small set of countries. Africa has a responsibility and has to take its own responsibilities and push to grow its own manufacturing industry. But we also acknowledge, and I don't agree with the view earlier that all the conversations about IP and tech transfer have to rely on voluntary. Voluntary is not enough, because we recognize even when we had vaccines and WHO, the WHO hub for mRNA technology, for example, there was no voluntary willingness to do tech transfer. Countries have got to enforce it. So whether you look at IP, I think IP, there's responsibilities on both sides. We need to actually make sure that African countries are able to use the existing privileges within the current TRIPS waiver, but tech transfer has got to be a critical part of them. That cannot be left to the goodwill of the manufacturers. It has got to be part. We have got to find a language that is acceptable to all parties within this accord. So we also need to stick to the rules that we currently have. The international health regulations, they weren't perfect, but we didn't adhere to them. Bans on exports were arbitrarily implemented that actually reduced the global capacity to respond effectively with the limitations that we did have. So we've got to, within this accord, and this comes to the argument, the conversation, everybody's saying we've got this time, this window, we've got to get it in the 6 months. There's no point in getting something in the 6 months that doesn't make us better prepared. Because if we do, then we lose all credibility. So it's not just about doing it in the time available, because it is right. Political attention is already moving on to the next thing, but we have still got to get it right. So I'm going to stop there, because I could go on, but I'm sure you want to put other questions to others. But those are the key issues that I think we need to, that are the challenges from the African continent that we need this accord and the conversations around it to address.
Thank you so much, Dr. Okereke, and thank you so much for engaging with the questions of the earlier panel. I think it's really important to be clear about this voluntary point, because we've seen that fail before. Now, over to you, Dr. Soltani, and just to build on what Dr. Okereke was talking about with the international health regulations. I have questions about your insight to this, to that process, which I know you all are revising at the moment. But usually, legal frameworks, international health regulations, these take years to develop and to form. And as everyone, pretty much everyone so far who's spoken has talked about this timeliness issue. And I'm curious if you think we have to have a consensus in 6 months. I mean, is this something that needs to happen now? What would happen if we don't reach consensus? And there is no pandemic accord. I'm curious to what you think is kind of the better option of rushing with no consensus, or getting something like what Dr. Okereke said, that is not what we actually need, or is kind of lacking in substance. Over to you.
Yeah, thank you very much, Dr. Ngozi. I just want to tell you that with regard to the amendments to the International Health Regulations 2005, I am very confident that we are well on course to be able to deliver on time. And I believe that, yes, we are really trying to work with what we have, but depending on how we approach the issues at hand, then I can see that there is the possibility for us to be able to submit an amended document for consideration by the World Health Assembly in May next year. Now, one of the things that I'd like to bring out, thank you for pointing out the issue of timelines. One of the things that is now becoming very clear is that we are really looking at these two processes, the negotiation for the pandemic accord and the amendments of the IHR. We tend to be looking at them as two processes that are tied at the hip. And I think there's a lot of pressure to be able to finish them at the same time. And I believe that where a lot of consensus will be needed, especially around the pandemic accord, then we might start seeing a lot of rushing. Of course, the most desirable outcome would be that we have both of them completed at the same time. But I just want to echo what was said earlier. In the spirit of trying to not look at it as a zero-sum game, we need a lot of consensus building, discussions. And so probably we now need to start looking at the two processes with the possibility of them ending at different times. But with regard to the IHR, of course, there are a few issues that really need to be looked at. But I believe that we can do it on time. Now, a lot has been said on why we are even amending this IHR. I think around implementation and compliance, which is the most important issue, why we even are amending it, I think there is a general consensus, but we just want to ensure that whatever framework comes out is accountable to all the member states, so that we are able to comply with the process, but then in a manner that is acceptable to all the member states. And then, of course, the fact that we might have this process, these two processes ending at different times, then we really want to see clarity in terms of the financing framework for the core capacities that will be required in the IHR, so that we can be able to be alive to the differences in the economic realities of the member states. And at the same time, again, an accountable framework to all the member states, even as we progressively look at ways in which member states can acquire stability economically. The issue of data also has to be addressed within this timeline, because we experienced a problem with data security. We do not want to have a set of regulations that are going to put us at a disadvantage, so that when we are obligated to share data, then the same data is weaponized, and then we are punished for it, or any other region in the world is punished for sharing data that we must share. So we must have provisions that will ensure that even as we share, as we meet that obligation of sharing data in the amended framework, then we are not going to be punished the way we witnessed before. And at the same time, the benefits that are coming out of the shared data, we want to also be able to see how we can be able to share in them. Now, in the interest of time, I do not want to repeat the issues around equity. I think that's a very important issue which has been ventilated quite a bit. And that is also one of the issues that we are really looking at. Of course, it is going to thread through the whole document, but then we really want to be able to see that equity has also been taken care of. Thank you, and back to you, Dr. Ngozi.
Thank you so much, Dr. Soltani. I think you made a lot of important points and addressed a lot of points, again, that I've seen in the Q&A, but just to say, to emphasize what you said, that the desirable outcome is for the IHR revisions, amendments, and the pandemic accord to be I guess confirmed at the same time or approved at the same time at the WHA. But realistically, if we're really trying to get towards consensus building, they may need two separate timelines. And I think that comment was more about the pandemic accord potentially needing a different timeline. And I think that's important for us to reflect on. All right, so to our next panelist, Noah Tegene. In your role at Africa's CDC, I'm just curious to how you see Africa striking this balance between establishing a regional emergency health preparedness and response mechanism, but also leveraging its participation in the pandemic accord. Is it at odds in any way, or is this a process that's actually facilitating kind of both activities? Over to you.
Thank you very much, Dr. Ngozi. First of all, let me appreciate and also thank the organizers for this important panel, and also for inviting us, Africa CDC, to be part of it. Regarding the regional global interaction and how we strike a balance in between, I would like to start from the basic fact that our position relies on. And as you know, we have been reiterating that Africa is a continent that has been historically disadvantaged when it comes to positioning itself and role on influencing the global health architecture. These have been reflected in so many things. If you look back the history of how these multilateral global mechanisms were set up, the representation of African Union countries was visibly compromised. Even during 1948, when the World Health Organization was established, the few African countries were represented because of the situation during the time. The regional office, how the regional office of the World Health Organization have been set up, also reflects that there was a historic power imbalance when these mechanisms were set up. When the international health regulations was negotiated in 1968-69, for the first time, African countries were not represented well during the negotiation. So the overall setup of these global multilateral systems lacks equitable and equal footing approach, where African countries can explain their context, their actual context, and also consider their situation within the provisions of these tools, instruments, and mechanisms. However, this left the African countries being disadvantaged in terms of implementation for a long period of time. So we need to address this root cause of what these global mechanisms lack if we want to improve them, meaningfully. That is why the African Union and the African Centers for Disease Control and Prevention have been lauding itself regarding this issue. The developments of the regional mechanisms over the years have been quite remarkable when it comes to the African Union. It was after 2014 where the world have encountered one of the biggest outbreaks of Ebola in West Africa, and then which spread all over the world. That was the time where the African Union member state leaders decided to establish the African Centers for Disease Control and Prevention, and since then, this center have been working closely with African Union member states in terms of developing their capacity when it comes to epidemic and public health emergency response. And now the COVID-19 situation also provided further evidence that still the global mechanisms kept failing Africa. And that is when our leaders again stressed on the need for strengthening regional mechanisms. So what we believe regarding the regional and the global mechanisms and how they should balance should be in a way that the rest of the world understands the basic truths that Africa has been compromised and disallowed, denied to develop its own capacity. At the same time, was also compromised from benefiting from the global mechanisms as well. So our approach is to correct what has been misdesigned, and also to make sure that the new approaches, the new mechanisms that will be designed now and in the future also considers equal footing and meaningful representation of African countries. Thank you.
Thank you so much, Noah. I really appreciate that comprehensive response and the history, really informing us of how, you know, before these structures were there, like the African Union, Africa CDC, there really wasn't a voice in shaping some of the agreements that we've already, that we are currently bound to, that countries are currently bound to. So I appreciate that. I'm going to go into the questions now for the next round of the panelist responses. I want to start with one from, and I'm getting these questions from colleagues, so apologies if I do not get your question. I apologize for that. So this is from Naheshon Aluhoka to Dr. Ebere and Dr. Sultani. The question is, by any chance, is there a worst case scenario or a bare minimum on what should constitute equity for Africa in the Accord? So what is kind of the lowest common denominator that you all think should be, if that's a good question to ask, should be considered for the pandemic accord? I see you're off mute, Dr. Okereke, so please go ahead.
Yeah, that's the wrong question, I think. There should be a lowest common denominator for equity for the world. It's not just about Africa. If we don't genuinely look at an equitable solution, the next pandemic will hit us all, Africa, Europe, North America, Asia, almost as badly as this one has. We need to stop seeing equity or defining equity as helping Africa or helping poor countries. Equity improves the quality of all our pandemic preparedness, improves the outcomes for all of us. And so I disagree with that question that we should be looking at what's the lowest common denominator. We need to be looking at what is the goal. The goal for the pandemic treaty, the pandemic accord, review of IHR is to do things better than the last time, recognizing across the board, rich, poor, that we all didn't get the best outcomes. We were not as prepared as we would like to be, and we didn't respond collectively to optimize the impact of our response. Therefore, equity is necessary. It's not a lowest common denominator. It's a highest common value. I remember my old O-level mathematics for all of us, not just for Africa. So that I would say, if we start thinking about what's the lowest thing that we can accept, well, we've got that. That's where we are today. And that's not acceptable. That's not why we're bringing all these countries together to discuss this with this pressure of deadlines, just to aim for a little better than where we are today. Now, let's aim high.
Thank you, Dr. Berry. Dr. Sultani?
Yeah, thank you very much, Dr. Ngozi. I think for me, what I would say, I might not want to call it a common denominator, lower or higher. But I think what we really want to see is clarity, so that we don't fall back into the same quagmire that we experienced with the IHR 2005, during the COVID pandemic. So we really want to be able to see the obligatory provisions providing for both sides. What is it? Because we know that the drivers for the amendments, for example, of the IHR and the negotiation of the pandemic accord was that we want countries to be able to comply. We want countries to be able to implement the IHR 2005. And so there are going to be some provisions that obligate countries to be able to have core capacities that enable them to implement these IHR 2005. Now, when it comes to that, then we really want to have clarity on issues around the financing framework, detail, so that it is not just aspirational. And then you find that some of the countries, and we are not saying, of course, most of them are from the global south and Africa forms the bulk of these countries. We do not want to have a situation where some of the countries with fragile economies are unable to meet these obligations. So clarity that provides for a financing framework that can allow these countries to meet their obligations around this issue. And then, of course, data security. How are we going to protect vulnerable countries? Like, for example, we can give the example of, say, reporting of new variants, which now result in a very, hostile reaction, weaponization of this data. And then countries are being faced with the danger of being locked out by the whole world. No trade is going on, no travel is going on. Can we be able to have clarity within the pandemic accord, within the amended document that provides for protection? When you share this data as a way of facilitating a response, then you will not be punished for it. I think those are now the issues that we really need to look at. I don't know if there's a better word than a minimum for them, but then I think in the outcome documents, we really need to see that clarity that provides. When we talk of equity, let us be able to see it. Let's be able to see it captured in a way that is enforceable. Let us not just talk about a very nice fairy tale situation that would help us to achieve equity, but it is not enforceable. So that now when we have countermeasures being produced, we are now not able to access them again. I think if we can have that clarity, then we should be able to have met our goal. Thank you, and back to you.
Thank you so much, Dr. Soltani. Before I go on, just to say, we're already 4 minutes over. I see a lot of engagement in the chat. I think people are very much energized by this conversation. I think you all, the panelists, are saying a lot of things that people are thinking and believe in. So I would beg everyone to give us 6 more minutes. We've already 4 minutes or over, so in total 10 minutes over. I'll ask another question and give a few remarks. I hope that's okay with everyone, if you can stand that. But just to say, I do appreciate the call out for detail and clarity. I mean, I think some of the things that you're saying, Dr. Soltani, especially around the financing, was echoed by Stephen of FCDO in the earlier panel, and I think that's something that needs more reflection and discussion and that clarity. But I also will leave today remembering that equity is the highest common value and not the lowest denominator, as Dr. Ebere so eloquently put that. So okay, on to one more question. So this question is about, I'm sorry, there's a lot of questions here. All right, we'll do this one. So this is from Patrick Maswangi. What worries us from the animal and environmental health sector is that the quota reserved for other sectors is very minimal. For an activity with 40 participants, 2 places are often reserved for others. At your level, what can be done to resolve this situation at the international level? So I think we're thinking about One Health, animal health and participation in the pandemic accord. When we're talking about IHR revisions, like how do we ensure that the multi-sectoral aspect is included and it's not just so focused on human health? And I think that would be a great question for you, Noah.
Yes, indeed, it is. Regarding One Health, we believe we believe that One Health is as far more important as it is for the rest of the world. Specifically, we believe that One Health should be addressed in a way that African countries can also benefit from the provisions of these mechanisms. As the problem still persists and we are vulnerable for all the issues related to One Health, including animal health, zoonotic diseases that can cause public health emergencies of regional or international concern. However, we believe that One Health should also be treated as other multi-sectoral issues like IP and trade-related restrictions, access and benefit sharing, and other discussions. We cannot single out One Health and then ignore the others. And this is the African Union position, in a way that if we have to consider One Health into this global instruments, we also need to consider the others. So this is where our position is. Otherwise, we are working with all stakeholders in terms of making sure that the One Health approach is being developed in a systematic and sustainable manner in Africa. But with this, I would also like to reflect that the African Union and its member states are not phobic of multi-stakeholder settings when it comes to governance. We want to have a meaningful representation, as I said. I think it was Martin, he indicated something about having a capacity fund, and that has been forwarded by the African group repeatedly. The issue is the existing financing structure again denies Africa to have a meaningful voice, as you know. And even after COVID-19, those that are recently established, like the pandemic fund, for instance, still didn't address our issues in a meaningful manner. We are still trying to struggle to get a position as an implementing partner, while Africa CDC is a core health institution of the Union. So this is not being phobic about multi-stakeholder settings when it comes to these types of mechanisms. However, this is a reflection of our quest for the rest of the world to treat us as equal contributors and as full members when it comes to providing our voice and influence on the design and implementation of these mechanisms. Thank you.
Thank you, Noah. So I was asked to have one more question, and it's to you, Dr. Barry. And the question is, would you, and I need you to answer in 1 minute.
Yeah.
Would you agree that the pandemic treaty should include an obligation for parties to refrain from procuring excess doses of pandemic products when there is limited global production capacity? Or is the suggestion to establish a mechanism led by WHO for ensuring minimum levels of production capacity in all regions? So I guess, do you agree with either or both or neither?
It's a bit of both. It's a bit of both, but I don't think just having a principle to say member states will not is enough. We have to put the alternative. And I think the WHO is the only independent body supported by appropriate monitoring and accountability measures and penalties to those who flaunt the rules. We should actually put in, so there's one, diversifying the manufacturing capacity, addressing the issue of IP and tech transfer in emergencies that will enable whoever, whoever's the first in line to find the solution for it to be spread so that there's equitable access in time, consensus on the definition of priorities irrespective of the resource capacity of the country. So that we do need, existing mechanisms are not enough. We know that, we've seen that. And part of the reason why the WTO is still talking about what allowances they can make make to allow access to therapeutics for COVID, even now that everybody thinks COVID is over, suggests that the existing system is not enough. So we've got to develop something that's specific to that. But the one thing I also wanted to comment on here, there's actually two things. One is around how we change the narrative for underrepresented groups, both in terms of geopolitical regions such as the African region, gender. I will those of you who know me know that I don't actually ever go through any panel and not mention the issue of representation of gender. Is we need to look at the composition of the bodies that make this decision, and it's not just the top governance, community of parties. At the end of it, is the actual throughout the whole process of where the solutions are being defined and negotiated, and ensure that there is equitable representation of the world as it is, not as the world as it was in 1948. And then the third bit I wanted to say in one sentence, which is around the finance, because we've talked about the financing repeatedly. There's been a lot of examples comparing COVID to the impact on the Second World War. So why are we not looking at similar financial instruments to respond to help countries to recover? We need to, beyond talking about the pandemic fund or Africa's epidemic emergency fund, we need to actually start to look at recovery. Debt relief for recovery. Countries have been hit by COVID as significantly as wars did. So why don't we have those same conversations about how do we look, and you mentioned that in the first panel briefly with Young Fen, about how do we actually start to think more broadly about economic recovery for health system strengthening, which is critical to pandemic preparedness.
Thank you so much, Dr. Berry. So much of what you said or in the closing remarks that I'm not going to be able to make because of time, but I do want to very much thank all of our panelists. And in the spirit of what you were saying earlier about it being one world, that it is not global north or global south, I think all the panelists have done an excellent job to really articulate their stances or the governments that they represent. And I want to express my gratitude for that. I mean, a couple of things that I am walking away with that I can say quickly is that I think everyone agrees this is not a zero-sum game, but then that means there has to be true inclusivity, right? That means that there has to be real meaningful discussion and engagement about these sticking points, like common and differentiated responsibility, as well as tech transfer and intellectual property. And so to really, I think, have the loyalty or the fidelity to this stance of not just being pretty words on a paper, that means there needs to be clarity and detail, as Dr. Soltani so well put his remarks. But I'll move on to also just thank everyone who was able to participate in the chat with the questions and the answers. We very much look forward to you joining the next webinar. Thank you to WHO and colleagues for hosting this important webinar and for supporting my moderation today. Meanwhile, if you would like to learn more about the Pandemic Accord or potentially engage in our next webinar, please remember to email us with the link shared in the chat. And we will see you at the next webinar. Thank you so much. Take care. Bye.
Thank you. Thanks for being an excellent moderator. Thank you all.
Thank you. Bye-bye.
Thank you. Bye.